Greg's responsibilities here at Harmons are different than a lot of people with his role, because Greg is the director of pharmacies for Harmons, but at Harmons we'd like to think of him as our wellness director. So Greg started our first healthy living department at Harmons. Even though he was the pharmacy director, he ran and operated our healthy living departments. He was behind putting dietitians in our stores. Greg's true love is health and wellness. He just happens to be a pharmacist and operate our pharmacies at Harmons. For whatever reason, Greg has the need to feel like he's making a difference, and we've all benefited from that, and it's driven him to put himself out there. And a lot of times it's with pharmacy, but at other times he's just willing to help out wherever's needed.
I think Greg makes a difference by being involved in a lot of organizations. I know he's involved in various state and pharmacy industry organizations. Being involved, it helps him stay in tune with the needs of our profession. And I think he's seen, through being on the State Board of Pharmacy, the harmful effects of opioid abuse.
Opioid abuse is a big problem in the state of Utah. I think for the last 10 years we've been in the top 10 as far as deaths per capita related to opioid. Anybody you talk to in the state, they know somebody that's been affected by this issue. And one of our core values at Harmons is community. And so this opioid issue is definitely a problem in our community. And so Harmons has done a number of things to try and help with the problem. One of the things we've done is we were one of the groups involved in the original Talk to Your Pharmacist Month.
The biggest ask of that campaign was to challenge pharmacists to talk to their customers to whom they dispense an opioid to for just a little bit longer than usual. And then the ask was that they use other materials throughout their pharmacy to encourage this conversation and to continue the conversation at home, such as sending home a brochure, hanging up posters, or the most important thing, putting a warning label on the pill bottle.
And we've been involved with a statewide protocol for naloxone dispensing. So if patients ever end up in an overdose situation, they can reverse that, or a family member can reverse that with naloxone. And then we also have a pretty rigid process when patients are filling opioid prescriptions, where we make sure there's a legitimate medical reason and try to make sure the prescriptions are written in a safe manner where we can.
Over the course of the last 2 years, Greg really has become the face of Talk to Your Pharmacist Month and of opioid prevention advocacy for pharmacies. We know that we couldn't have had the influence on pharmacists and couldn't have got pharmacists to participate in these prevention efforts to the degree that they have without Greg championing it and being that face. He literally has been kind of the face all over through different videos we've created, through media stations, and him always being our contact anytime any media folk reach out and want to do a story. We connect them with Greg.
Greg will be there. You know, he's just that kind of guy. He just doesn't let people down. If he says he's going to do something, he's going to do it.
I think why this opioid issue is such a big deal to him is because he cares about people. He's seen friends and neighbors struggle with opioid abuse, so it strikes him at a personal level. And so as a person of influence with Harmons and pharmacy, I think it's just natural for him to take that concern and then move it into a place where he can have a huge influence over this issue.
People aren't at the pharmacy because everything's going well in their life. They're there because they're sick, or their child's sick, or maybe their mom has cancer. And you really have an opportunity to impact people's lives, and it feels good at the end of a busy day when you've had a couple hundred people tell you thanks, and to be able to think that you made a positive difference in their life that day.